Welcome to Wellness and Wisdom. This is the podcast where we talk about different issues concerning health, agriculture, business, and religious issues. In today's podcast, we want to talk about health issues concerning the cervical cancer as a disease. So, in the studio, I have a guest today. But remember, you're free, Rahab Ngogo, your host. So, many people know you.
Why, thank you. I am Bob Kumbea. I am a doctor at GHS Hospital here in Blantyre City in Manje.
Yeah, first of all, I think people should understand when we say cervical cancer, what is it?
Well, when people hear about
Hmm.
cervical cancer is a type of cancer
Hmm.
that occurs in the cervix, the lower part of the uterus.
Hmm.
So this mainly it happens in the female reproductive system.
Yeah.
So it is also the main cause of this cervical cancer is human papillomavirus,
Hmm.
which other people call it in short HPV.
Yeah. So maybe should we say that cervical cancer? Maybe is it sexually transmitted infections? Like it can increase the should I should say that can other sexually transmitted infections, this STIs now,
Hmm.
can it increase the risk of cervical cancer?
Yes, and the STIs, which is sexual transmitted infections,
Hmm.
they are the at the high risk of someone who is having STIs.
Hmm.
They are the ones who are at risk, higher risk
Hmm.
of developing cervical cancer.
Hmm.
So this is due to these reasons. Uh, Someone who is having gonorrhea
Hmm.
and also HIV and AIDS.
Yeah.
These are STIs that were major risk uh, that affect someone that can trigger cervical cancer. Because when, for example, HIV and AIDS,
Hmm.
HIV and AIDS mostly it weakens the immune system.
Hmm.
So when it weakens in the immune system, that means the person is at a higher risk for developing cervical cancer. So when uh, when a person has a weak immune system,
Hmm.
this that means his body or her body is at higher risk
Yeah.
because their uh, I can say in short that the immune system, the defense of our body
Yeah.
can no longer defend the incoming uh, cancers, cancerous cells.
Yeah.
So which means when the body defense mechanism has been defeated,
Hmm.
at the end is when a person can develop cervical cancer.
And maybe should we say that there's a link between a hormonal birth control and cervical cancer?
Yes, there is. So the link is it happens uh, mostly because of the HPV interaction,
Yeah.
hormonal mechanism also.
Hmm.
So, but I can relate it to say HPV, which at the end it weakens the immune system.
Yeah.
At the end, can trigger
Yeah.
the uh, it has potential link
Hmm.
to trigger cervical cancer. I can say in short.
Okay, so maybe there can be other listeners. Maybe they are experiencing some of the things like the signs, like the whatsoever. Maybe they don't know actually. Maybe what is the problem with them. So maybe what are the early warnings or the signs of cervical cancer?
Okay, the early signs of the cervical cancer
Mm,
is when someone is experiencing unusual vaginal bleeding,
mm,
also between periods,
yeah.
so after sexual intercourse, and also heavy or prolonged long periods.
Mm,
So number two, when someone is also experiencing abnormal discharge,
yeah.
these are so the one of the signs that a person should take it seriously
Yeah.
and they should also seek help as fast as possible.
Yeah.
Also, someone may experience a lower back pain
Mm.
or abdominal pain,
Yeah.
so it just depends.
Mm.
Also, someone can have signs like you can experience urinary symptom like uh, frequent urination.
Yeah.
Yeah. So also when you are having it, you can be someone can experience maybe when she's urinating, she can be having some pains.
Yeah.
So blood also producing blood in urine. So those can be the signs also. So someone also can loss of weight can also be another early sign.
Yeah.
So loss of appetite. Uh, some people may experience that they might lose appetite to
Mm.
food. So these are the early signs of cervical cancer that someone
Mm.
can see as they are experiencing or they are developing cervical cancer.
Okay, so our listeners, those are the signs, the early signs that maybe you can notice about cervical cancer. So maybe how is cervical cancer diagnosed now?
Okay, cervical cancer can be diagnosed, and
Mm.
there are several steps that someone can go.
Yeah.
So there are screening tests.
Yeah.
So in screening test, a person has to go through a pap test.
Mm.
So a pap test, these are now we deal about cells from cervix. So we collect cells from cervix and we examine them.
Mm.
And also number two on the same screening test,
Mm.
we do uh, human papillomavirus test.
Yeah.
So we there are different types there we use to check. So human papillomavirus test
Mm.
is also another test that we use to test someone who is developing cervical cancer. And also
Mm.
we're gonna go for colposcopy. So this is this like I've just said that someone who is developing at first the signs, the early signs
Yeah.
might have a problem with some visual examination. So we also check about that. So
Mm.
visual examination of cervix, we do that with magnification in
Mm.
order to check clearly. Because there are some things that we cannot examine them, but we use some special magnification
Yeah.
in order to see them. So we have also some laboratory analysis.
Mm.
So we learn also one by pose. So this is also another test we
Yeah.
use to test someone who is developing a cancer problem. So I've talked about diagnostic test. So there are some procedures so which a person can go through
Mm.
as we are diagnosing that person. So procedures a person goes through a pelvic exam.
Mm.
So we analyze, we examine the reproductive organs, and the number two, we imaging test, which is we call it in our own terms CT, MRE, the abbreviation.
Yeah.
So to long names in our language. So we evaluate cancer that let's say in cervix. So it's where we evaluate cancer where maybe it has spread over the cervix.
Yeah.
So we use imaging test rather.
Yeah.
So we also do a blood test. A blood test, we check the liver and the kidney function, how it is functioning.
Mm.
So if a liver and kidney is functioning weaker, so we tell a person and how how he can do or
Mm.
she can do in order to avoid further spread of cancer.
Yeah, and maybe now should we say that cervical cancer is it in stages or just that is just a state where maybe you just generate?
Well, there are several stages of
Hmm.
cervical cancer, and the number one stage is where
Hmm.
uh, cancer is confirmed to the cervix.
Yeah.
So when cancer is confirmed to the cervix, we call that as a stage one.
Yeah.
And number two is where now the cancer is now present in the cervix,
Yeah.
but on the upper portion of the vagina.
Mm.
And the stage three uh, is where now cancer has moved to the lower portion of the vagina
Yeah.
or the internally to the pelvic side wall. And also the last stage
Mm.
is where now the cancer is spread to the nearby organs.
Yeah.
So such as bladder
Mm.
or rectum, or it has spread to other areas of the body,
Yeah.
such as lungs or liver or bones. So these are the stages of cancer
Mm.
a person or they are that were grouped into four.
Yeah, so maybe there can be other listeners listen to this podcast. They can be like, okay, I'm pregnant, but maybe I want to get the test. Should we say that can cervical cancer be detected during the pregnancy?
And so cervical cancer can be detected during pregnancy.
Mm.
Eh, but however, diagnosis and treatment may be more complex due to pregnancy related changes and
Yeah.
concerns. So, but during the pregnancy, we use pap test, what we call pap test. So it's a routine pap test uh, that is recommended at the first prenatal visit. So this is a first stage that a pregnant woman must go through,
Mm.
and also number two is a human papilloma virus testing.
Yeah.
So this is a routinely recommended during pregnancy. So this is the most important testing to see if the pregnant woman is suffering from has already developed the
Yeah.
cervical cancer, and also number four,
Mm.
so which is the biopsy. So this may be performed as if col- colposcopy results are suspicious. So there might be some results that are suspicious.
Yeah.
So we do that test in order to find out more about if a woman is suffering from cervical cancer. So there are some women that they might have some symptoms during the pregnancy.
Mm.
So we also check if the woman is already suffering from has been experiencing or has been having abnormal breathing, vaginal breathing, or
Yeah.
pelvic pain, abnormal discharge, or unexplained weight loss. So when we ask them about this question, if we have checked that they are suffering from this, so that woman can no longer go through a cervical cancer test during pregnancy, since these are the notable signs that a
Yeah.
person has already developed the cervical cancer.
Yeah. So maybe one has been found cervical cancer positive. Let's say that. So the person is pregnant, and maybe what can be some of the dangers if one is found uh, with cervical cancer during the pregnancy?
Yeah, so a person can okay, the pregnancy can be affected in such a way that
Mm.
a pregnant woman can have a delayed treatment. So a pregnant may delay or because of cancer treatment.
Mm.
So, but the sad thing is that most women can go through is pregnancy loss. So a pregnancy, a woman can lose a pregnancy. So which is a very bad thing.
Yeah.
So, but there are some risk to the fetus also
Yeah.
during uh, uh, the pregnancy. So a fetus can have a low birth weight because someone who is having cancer, cervical cancer
Yeah.
can be having a like just what we said that there are some signs that a woman can go through. Just some of them we have mentioned that it's a loss of appetite. So that loss of appetite,
Yeah.
a fetus can a woman cannot like cannot be eating food, so at the end which can affect the fetus
Yeah.
to have a low birth weight.
Mm.
So at the end, and also uh, can be some risky to fetal distress,
Yeah.
and also preterm death. So all these are the risk to the fetus that can the fetus can experience during the pregnancy period
Mm.
of the woman.
Yeah, maybe so. Now let's look at the condition where maybe a pregnant woman is found, maybe like, or maybe she's seeing the signs you have talked about cervical cancer.
Mm.
Should we say that the person can now be treated during the pregnancy?
There is a 50-50 chance
Yeah.
if the cancer has not spread,
Yeah.
that person can be treated. But if the woman has failed to identify the early signs of cervical cancer,
Hmm.
so when she has failed to identify and the cancer has spread,
Yeah.
at the end, uh, she can experience the pregnancy can be aborted at the end.
Yeah.
So it's very vital to a pregnant woman to be visiting the hospital,
Yeah.
to be seeking checkup regularly, so that she can be learn some few things about this cervical cancer.
Yeah.
So some cancer treatment can be that a woman can go is chemotherapy. So this is this can be administered after the first trimester.
Yeah.
Also, we can do a treatment called radiation therapy,
Yeah.
typically avoided during the pregnancy because this can also cause some risk to the fetus,
Hmm.
and also targeted therapy. Also, this can be considered as a advanced cancer treatment.
Yeah.
So, in addition, we also have HPV vaccine.
Hmm.
So this HPV vaccine, not everyone. There are specific vaccines that are because they are different. We treat at each and every stage. We treat every each and every woman at depending on the type of vaccine
Yeah.
of HPV.
Hmm.
So there are some girls, young girls, who
Hmm.
might have pregnancy at their early age.
Yeah.
So we have their own specific HPV vaccine.
Yeah.
So these are pretends like the ages from 11 to 12 years.
Yeah.
So we give them two doses of series.
Hmm.
So when they are, this can take from 6 months to 12 months.
Yeah.
So after they are given this HPV vaccine,
Yeah.
and also we have teenagers.
Hmm.
The same, it's like a routine of vaccination, as I've said, that are the uh, preteens, teenagers. They are also specific vaccine. So teenagers
Yeah.
starting from 13 to 18 years,
Hmm.
they are given 3 dose series. So this can run for to 1 to 2 months,
Yeah.
and also after that we give them after that they also come for 6 to 12 months another test, another to be given another vaccine another.
Yeah.
So to others, I can say young adults aged from 19 to 26.
Yeah.
So we give them also 3 doses, same as their teenagers,
Hmm.
and the women now from age from having age from 27 to 45 now.
Hmm.
So we have their own specific vaccination. So, but for those, we have special considerations
Yeah.
like a woman who is having HIV positive.
Hmm.
So we make sure that they should seek a area vaccination as soon as possible.
Yeah.
so that any delay they
mm,
can die in the process, because their immune system they are weakened already. So if
yeah,
they are late at taking this vaccine,
mm,
they might uh, lose their life at the end. So breastfeeding women also may also uh, have this vaccine also as well.
mm,
We may give them their special as their special vaccine. So
yeah,
in short, to summarize, I've said girls 9 to 14 they are
yeah,
given two dosages, and girls aged 15 to 26 also they are given three dosages.
yeah.
Sure.
So maybe other listeners can be like, maybe from what I eat, maybe can help me, like maybe to prevent cervical cancer. So maybe my question should be like, maybe can cervical cancer be prevented through maybe the lifestyle changes, or maybe the dietary modifications, like maybe what people consume in their daily lives.
Yes, and before most of the disease that we suffer nowadays,
Hmm.
it's because of we lack a special diet that
Hmm.
wow, we can follow.
Yeah.
So dietary is recommended for that special diet that is recommended
Hmm.
for someone to prevent uh, cervical cancer,
Yeah.
and there are some other there can be special foods that a person can take, and
Yeah.
this is a must that a person should also having as a lunch or supper or
Hmm.
even in morning food.
Yeah.
So there are some simple food that a person can take, e.g. They can what we have. There are foods that are special that are having vitamin E.
Yeah.
So vitamin E rich foods like nuts or seeds, and also a person can also take the vitamin C. So foods like citrus foods.
Yeah.
So they might look like they're sour, but at the end, a person can benefit.
Hmm.
Yeah. So citrus fruits. So also a person can have there are also green. Also there are some leafy greens, vegetables.
Yeah.
So there are specifically dark leafy greens.
Hmm.
Those ones that are dark, very dark leafy.
Yeah.
So also legumes. A person that is taking legumes can also reduce the risk of taking in taking cervical cancer.
Yeah.
And also a person taking when a person is taking fish, so she can also reduce the risk of uh, taking in cervical cancer. But at first, when a person at first the primary prevention that
Yeah.
person can prevent
Hmm.
also these are like a daily activities. When a person is smoking, it can lead to cervical cancer also.
Yeah.
So when someone is avoiding smoking,
Hmm.
uh, that one can reduce the risk of taking cervical cancer.
Yeah.
So healthy diet is recommended, just as I said, that
Hmm.
a person who is eating fruits, vegetables, grains, and also someone who is doing exercise daily.
Yeah.
And this may seem like a very tough thing to do
Yeah.
for some ladies,
Yeah.
because they think that jogging cannot benefit me anything. But at
Yeah.
the end, doing exercises this may help to reduce and
Hmm.
also to boost the immune system,
Yeah.
since the body becomes now strong now, and it's like you are empowering the defense mechanism of the body.
Yeah.
At the end, it can fight against the diseases, so
Hmm.
which in this case we are talking about cervical cancer.
Hmm.
So maintaining exercise, it helps to maintain the health weight, because
Yeah.
a person who is suffering from cervical cancer
Hmm.
might experience the problem for losing weight.
Yeah.
So when a person is doing exercise regularly, so a person can maintain the weight at the end.
Yeah. So maybe there can be other listeners who are ignoring the signs. They see the signs, this, and this, that you have already talked. So maybe there are rumors outside here. People be like, maybe after you have received the treatment for cervical cancer, maybe you'll be infertility, something like that. You see?
Mm.
So maybe my question should be like, does cervical cancer treatment affect the fertility and the reproductive health?
Cervical cancer treatment can
Mm,
affect fertility and reproductive health
mm,
since there is a there are some treatments that a person who has a cervical cancer
mm,
that has gone through, like a person maybe has gone through a surgery treatment.
mm,
So surgery treatment, they might have a problem like when the cancer has spread.
mm.
So the doctors may not have a choice
Yeah,
but to remove the uterus, so making the pregnancy impossible. You know,
yeah,
when the uterus is removed, that means a person can be cannot even bear anymore.
yeah,
So and also there are some extent that they also remove cervix because it started in the cervix. So
yeah,
if they remove the cervix, and also this can also
mm,
affect the fertility of the woman.
yeah,
And also at the end, this when they're doing surgery,
yeah,
they might damage also the reproductive some reproductive organs,
yeah,
which making it at the end difficult for a woman to uh, have children.
yeah,
So uh, at the end, it's like a higher probability that a woman can bear no more.
yeah.
So that's
Yeah, so we should say that the best thing is that when one is recognizing these signs, should maybe visit the health services very fast. Like should meet a doctor or a nurse, maybe and explain.
yes, exactly. Because at the first that the cancer can be treated,
Yeah,
but when someone has been rejecting to seek treatment as soon as possible,
yeah,
at the end, when the cancer has been spread to the reproductive organs, some reproductive organs,
yeah,
which at the end we see that when the cancer has been spread
yeah,
more and more, and it has affected the other parts of the reproductive organs,
yeah.
we don't have any other choice to save the woman, so we remove the uterus. So
Mm,
if a woman is has not seek help immediately,
yeah.
at the end that woman can never bear children.
Yeah, so maybe as we are going towards the end, maybe how can family and friends support loved ones, maybe who has been diagnosed with the cancer, cervical cancer?
Well, as a family, it's
Mm,
very important to to monitor them
mm,
when they are passing through these difficult times. You know, when uh, cervical cancer has been uh, found and has been detected at first,
yeah,
and it's a law of family members to in order to provide the woman like with a well balanced diet, which
yeah,
can at the end reduce the further spread of cervical cancer.
yeah,
So it is a duty of family members to seek for uh, food, specific food, in
yeah,
order that will boost the immune system
mm,
of their mom, beloved mom, and also encouraging them to do physical exercise regularly, which at the end boost their will enable them to maintain their body weight.
yeah. And
Sure.
maybe other listeners may need to know something. Maybe they will be like, can cervical cancer survivors now, like the person is being treated and maybe she's okay. Maybe they can the cervical cancer survivors experience maybe the sexual intimacy or the maybe dysfunction?
Of course, they might experience this, sexual dysfunction in a sense way that if your partner has a, let's say, STIs,
Yeah,
these made encourage them, and it's very encouraging to say that they should use protective measures
yeah,
so that they should not affect each other furthermore. So which at the end I can say to some they might not find it very uh, very important to use uh, condoms, which at the end may result to say they might feel a certain dissatisfaction.
Yeah.
So this the use of condoms. So at the end, they might even though it's very helpful to them
Yeah.
to prevent them to suffer from cervical cancer, but it is very advisable to them to use condoms so that at the end they might prevent this further spread of cervical cancer.
Yeah, and maybe using this podcast, maybe how can you encourage more women to get screened for cervical cancer?
Well, what I can encourage women is that for you to prevent the spread of cervical cancer,
Hmm.
uh, every woman must keep on checking her health
Hmm.
regularly. It is very advisable, and we have mentioned on the basic stuff that person should do in order to avoid cervical cancer.
Yeah.
So it is your law in order to prevent and also to even to stop further spread of cervical cancer, even to increasing the cases of cervical cancer.
Hmm.
So by maintaining the diet, make sure you are taking the right food,
Hmm.
and also make sure when you are pregnant and uh, when you have seen yourself that you have seen that some sign that they're developing,
Hmm.
I would encourage that you should seek help as fast as possible so that you should not suffer from cervical cancer, because at the end we have seen that it can cause if it is spread, it can cause barrenness to some women. So
Hmm.
who doesn't want children? So it's very advisable for
Yeah.
women to avoid, so that at the end they should remind they should have the the right number of their planning children.
Yeah.
uh yeah, so that's what I can encourage women.
All right. Reaching this far, this is the end of our today's podcast. We are talking about cervical cancer. I hope the message shared is very helpful to our listeners. Thank you.